Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. It's Sunday morning and I'll be seeing a few patients, but on the weekends I always like to take these clinical pearls and focus a little bit more on practice management tips. Now this is a challenging conversation. It's based on a question that I received a few days ago from a young orthodontist. And the question is, what do you do if patients are having trouble making their payments? Now, I never liked talking about money. Early in my career, I gave many lectures on money and practice growth, and I have a lot of regret on that behavior. I was interested in that topic. I thought others were interested in that topic. And I also thought that it validated me as a young orthodontist, and now I really shy away from any of that material. But I think it's an important conversation to get into. It is challenging to introduce on a public forum, but I'd like to share my thoughts, and I hope they come across well. So I think what people expect me to say when they ask this question is let them know what collection agency that I use. But I don't send people to collection. I strongly encourage nobody to send anybody to collection. If somebody is having trouble making payments, first and foremost, please talk to them. We are treating people and not teeth, and people are going to go through many challenges in life. They're going to go through unexpected events and expenses, the loss of a family member, job transition, a relationship breakup, illness, anything. And the last thing on their mind, college payments for their children, the last thing on their mind is going to be paying for an elective orthodontic treatment. So I think if you talk to someone and just be very candid and say, hey, is everything okay at home? Show empathy and just try to have a very candid and kind conversation. They might say to you, listen, this is just a really tough time. You can completely refund treatment. I've done that many times and say, hey, listen, can I just refund you? Would that make things easier? Or you can say, hey, listen, what if we just delayed payments for 6 months and on June 1st, we can reconvene and start doing the payments again. Would that make things a little bit easier for you? So I think first and foremost, never send someone to collection. I'm not into that world. There's nothing wrong if you do that, but that's not how I run my practice. But I would always talk to the person and see what we can do on our end to make life easier for them. And I think that's where I'd like you to start. Number two, if you are having a lot of patients having trouble making their monthly payments, I would suggest that maybe your initial down payment is too low. When you are a young orthodontist, you want to have very, 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 very low initial down payments, and there's nothing wrong with that. I think we are famous in our community for making braces affordable. And if you have a good down payment, they can get ahead of their monthly payments, no different than a mortgage on a home. And if you are doing $250 or $500 for a down payment, I hate talking about money, but I want to get it out here. I think it sets the patient up for expensive monthly payments, which can be very hard, particularly if you miss 1 month. So my suggestion would be, if you're having many patients have trouble making their monthly payments, I would increase your down payment a little bit. And last and least, you can simply remove the in-office financing option. You could just simply do third-party financing. We use Lending Club. We think they're very patient friendly and they're very forgiving on patients, that I really like. And we do interest-free financing. So I actually pay my patients interest and they just simply pay monthly and it's easier for them. And that way there's no pressure on our end and it's easy for them on their end as well. So 3 options: talk to people, really show empathy, and either refund them or delay payments. Number 2, consider increasing your down payment option to make monthly payments easier. Or number 3, just remove that option and do interest-free financing so patients can simply just pay monthly without even having to put down a down payment through a third-party financer. Those are my suggestions. Let me know what you think about this pearl. Thank you guys so much for subscribing to this channel. Thank you for supporting the JCO.